Universal health coverage is emerging as the dominant framework for countries to increase access to affordable quality health services. It builds on the principles of universality and the right of individuals to access quality health services regardless of their ability to pay and without suffering the risk of financial hardship. As we all know, there is no single pathway for countries to achieve universal health care. Since the launch of the SDGs in 2015, where UHC emerged as the target under SDG 3, low, middle-income countries around the world have pursued their own courses of action to operationalize what is, in essence, an aspirational vision statement, a vision where all people can obtain the prevention and treatment health services they need without suffering financial hardship when paying for them. In an effort to transform this aspiration into actionable plans, we've seen countries introduce insurance or other strategies to reduce financial hardship. We've seen countries embark on health system strengthening and the exemption of user fees, and we've seen countries launch health sector reforms that include reorganization, decentralization, and new policies on user fees. The choices countries make are not arbitrary. They're not ad hoc. They reflect the economic wealth of the country, the relative contributions of the public and private sectors, different disease burdens, the dominance of donor support, and often political interests. As the largest voluntary network of reproductive health organizations in the world, we in the Reproductive Health Supplies Coalition have worked to advance the inclusion of reproductive health services and supplies within national universal health care plans. We've played an important coordinating role by helping countries recognize the value of reproductive health within the broader universal health care agenda, by advocating for the inclusion of reproductive health within essential health benefits packages, and in particular, the supplies that make those services possible. And finally, we're working to garner the evidence base needed to strengthen the systems on which universal health care efforts depend. But we're also working to ensure universal access by focusing not just on what makes universal health care frameworks different, but rather on what they hold in common. We ask how these shared attributes relate to, and perhaps even put at risk, the essential attributes we define as integral to reproductive health commodity security, and these are availability, choice, quality, and equity. And it has been up to our member organizations to mitigate those risks by supporting the development of tools and approaches to address them. I should point out that well over half of the members of the Reproductive Health Supplies Coalition come from the Global South. They represent 59 countries and are distributed across governments, technical agencies, civil society, and manufacturers. So what then are some of the core elements all universal health frameworks are likely to share in common? One, they'll be financed primarily, if not entirely, through domestic resources. They'll all be national in scope. They will all have in place some scheme for prioritizing coverage and or the groups to be covered. And they'll all operate on a scale likely to surpass anything seen before at country level, be it in the private or the public sectors. As barriers to access fall, the demand for services and supplies will increase. What I'd like to do this afternoon, or this evening, is focus my remarks on two of these. One, on the predominant role of domestic financing and the certainty of rapid expansion of services. Both of these will allow me to describe the ways our partners from the Global South are working together to maximize opportunities and mitigate the challenges that arise from each. This month, we published our 2019 Commodity Gap Analysis, which looks at four things. It looks at projected growth in the consumption of family planning commodities over the coming decade. It looks at the cost of those commodities. It looks at where the funding for where those commodities will come from. And four, it asks what gap will exist if donors, national governments, or the private sector fail to maintain their share of the financial burden. And what the report tells us is that over the coming decade, the future of commodity financing will increasingly rest with countries themselves. Country governments are outspending donors 3-1, and out-of-pocket expenditures through the private sector absolutely dwarf both country governments and donors. And I think you can see on the diagram here the extent of private sector value in contraceptive procurement. And you can see on the bottom there, donor versus government, the relationship between the two. So governments are already taking a key role. What's more, as countries become wealthier, the share of funding attributable to domestic sources, be it government or out-of-pocket, also grows. As countries look to finance universal health care, we expect the same pattern of change. The bulk of financing will come from domestic resources, which means that countries, irrespective of where their financing originates, will need to stretch every dollar, every shilling, every peso, every dinar. They will need tools and market intelligence to secure better procurement terms, better prices, shorter lead terms, and adequate support. And if that doesn't happen, we can expect some pretty dire consequences. We could see product quality suffer as governments find themselves with little choice but to look for the cheapest option. We could see services cut as universal health care programs tighten their financial belts. For the past 3 years, our Spanish-speaking regional forum in Latin America, the Foro LAC, has worked to raise awareness of the ways the global community has increased access to reproductive health supplies and services. Latin America was the birthplace of the international family planning movement, but with the region's economic growth, international support effectively came to an end. Countries in the region found themselves effectively isolated from ongoing global progress and movements, such as FP 2020, which in the last decade has helped bring down the cost of key contraceptive supplies, established global standards for quality assurance, and yielded greater efficiencies in delivering family planning services to the last mile. To confront this isolation, we brought the lessons of the past decade back to Latin America, and in the process helped countries across the region help themselves. Through a series of local convenings called encuentros, we have seen local partners come together, leverage their purchasing power to achieve significant price reductions, and we have seen the cost savings from those reductions being reinvested in greater procurement volumes. Foro LAC has also advanced greater pricing transparency by developing new business tools that allow registered government procurers to see what other countries are paying for the reproductive health supplies they purchase. This new online price platform called Supremi was developed by national procurers across the region to help them negotiate more effectively with pharmaceutical manufacturers. The procurers determined which products to track. There are now 60 categories of products within Supremi. They identified the relevant data fields, they shaped the terms of use, and today they populate the tool with the necessary price and procurement data. And already we're seeing results. Last month, Nicaragua's Ministry of Health acknowledged that as a result of their access to Supremi, they would be ordering commodities from a different supplier, thereby saving thousands of dollars. Now, returning to our 4 core attributes of universal health care, there's another attribute that's growing, and that is the growing scale of services and the supply requirements likely to result from it. As I mentioned earlier on, as barriers, and particularly financing barriers to access fall, demand for services will increase. In fact, it will likely surpass anything we've seen before at country level. And as demand for services increases, so too will the demand for supplies. One critical factor to keep in mind is that the market for supplies, all supplies, is a global market. And those institutions best equipped to manage and capitalize on the market are the ones who see jointly and act jointly. When countries go it alone in the global market, they miss out on greater efficiencies or economies of scale. And this is what happened to Latin America in the past decade. The ability to manage an ever-increasing flow of supplies depends on good market intelligence and close connections to supply chain partners. Countries need to forecast accurately and to share those forecasts with others to aggregate orders. They also need to connect to suppliers to know when commodities can be bought, and once bought, where they are. Likewise, for suppliers to manufacture efficiently, they need to be able to judge demand accurately. For almost 3 years now, the Reproductive Health Supplies Coalition has been bringing together these supply chain players to transform the reproductive health supply chain. We've established what we call a global family planning VAN, for Visibility Analytics Network. It's a collaborative platform where countries, manufacturers, and procurers can access supply data to make supply chain decisions together. New processes are shaping the ways countries like Nigeria and Malawi, both pilot countries, initial countries under the global VAN, are interacting with others on the platform to analyze data and make decisions. By aligning country demand data with production data, we can do more with limited resources to end stockouts and ensure contraceptive choice, all of which threaten an ever-expanding program of universal health care. How is the Global Family Planning VAN changing the status quo? Well, in a world without the global VAN, which you see on the left, each country is an island struggling to make separate deals with all its supply partners. Making and maintaining these connections is expensive and inefficient. In a world with the global VAN, on the right, we see everyone interacts through a single connection. This is the entry point to a more efficient, rapidly growing marketplace. The global VAN is already a reality, and efforts are underway to increase the number of active partners, manufacturers, procurers, and partners, global country partners from the Global South. Following my presentation, we will be hearing examples of efforts to achieve universal access across a diversity of countries and contexts. And as we will see, each context presents unique challenges the broader reproductive health community is working together to overcome. In pointing out Supremi and the Global Family Planning VAN, my key message this afternoon is that underlying the seeming complexity of a diverse universal healthcare landscape, there exists a core of common challenges and opportunities. Many of these can only be addressed effectively through countries in the Global South, and they can only be addressed by countries working together. In short, South-to-South cooperation. Thank you very much.